Alright, so do any of you know someone that suffers from forgetfulness? Are they often easily distracted or have trouble organizing activities? How about someone who can't help the impulse of interrupting or changing subjects? Well, what I have just described are the main symptoms of a rising problem with our youth: attention deficit hyperactivity disorder, or ADHD for short. I will be explaining to you the history of ADHD, how it's diagnosed, and how to treat it. ADHD, surprisingly, has only been classified a disorder as recently as within the past 150 years. The first recorded cases were around 1902, according to the U.S. National Institute of Health's Library of Medicine. In one of them, researchers found a child who couldn't concentrate on a game for more than a few moments, or anything for that matter, but was bright and intelligent as any other kid in speaking or in manner. This, along with other cases, began rising concern for the well-being of kids who showed these traits or worse. The first signs of ADHD were described as passionateness, spitefulness, jealousy, dishonesty, viciousness. As awareness of this rose, it started to become an actual medical problem. At first, it was called a defect of moral control, then hyperkinetic disease of infancy, onto attention deficit disorder, and then subgrouped to add the hyperactivity to it. So now you know the history and background, we can move on to the present information that we have on ADHD. In most cases, ADHD shows up in children before the age of 7. ADHD has many different qualifications and can be afflicted with several different disorders. We now have a couple different types of ADHD also. There is inattentive ADHD, hyperactive ADHD, or a combination of both. What contributes as inattentive is shown over here on the chalkboard. It would be not paying attention to detail, making careless mistakes, failing to keep on task, not listening, being unable to follow or understand instructions, avoiding tasks that involve effort, being distracted or forgetful, or losing things that are needed to complete tasks. As for the symptoms of hyperactivity, it would be fidgeting, squirming, getting up often when seated, running or climbing at inappropriate times, having trouble playing quietly, or talking excessively or out of turn, interrupting. So this is all determined by the DSM-4 to diagnose ADHD and other disorders in the U.S. DSM stands for Diagnostic and Statistic Manual of Mental Disorders. And we have the DSM-3 here, which helps me out with a little bit of my research, and also, even though it's kind of old, it still had pretty relevant information in it. And so now that we know what the symptoms are, let's get into the treatment. There are several methods to dealing with ADHD, though taking stimulants has shown to be one of the most effective in calming patients. There are two forms of stimulants that are used for medication. The first form of medication is called methylphenidate, which most know as Ritalin. Second is amphetamine, which Adderall is made from. Though they are basically the same thing, amphetamine it has a more addictive side effect. Other than that, they both have the same side effects with anorexia, insomnia, or weight loss due to having no appetite. ADHD doesn't always have to be treated with the use of medication. Behavioral therapy is one treatment approach that involves having a therapist figure out the problems and working with the patient to diminish them. An example of this type of intervention would be a case done by Dr. Rob Dio, a board-certified family physician. A child was struggling to remember to brush his teeth. He worked with the child by setting up routines and writing down what he needed to do so the kid could remember. After this continual process, the kid grew into the habit. Another non-med solution would be lifestyle change. Exercise is one powerful intervention, says Matthew B. Pontifex, PhD, an assistant professor of kinesiology at Michigan State University. Sleep and diet also could play a part in the effects of ADHD. Maybe allowing a few extra hours of sleep or providing less sugar in meals could show improvement. Empirically, a combination of both medication and talk therapy showed to be the most effective method. Now you know the different methods of treatment and know most of the information of ADHD. Once again, I have told you about ADHD, how it started, and where it is now. I also discussed the history, how it's diagnosed, and how to treat it. So thank you all for being here and listening to my speech. And my name is Vinny Losselaker.